Hello and welcome to Seven Sentinels. This is Grandmaster class, and I am Peter Simon with you. We are starting a series of sessions for writing for both doctors and nurses, along with the sessions for other professionals. Reaching the masses is our goal for the things they require. So today's theme is eloquence, the meaning of which is the quality of delivering a clear, strong message to the world about what we are, what we are going to do. Yes, this is a message to the students and the right targets to be reached. Admissions are open for not only writing only sessions, but also for the complete program for 1 month and 100 days for both the nurses and the doctors. Doctors, 3 admissions, and nurses, 7 admissions. Limited registrations. We'll be very selective in taking the admissions. The writing task for the day, Anne Ballard. And the case is 2nd degree burns. 2nd degree burns. These are limited edition sessions. We'll go only with the main points, and it will be a fast track, 40 minutes session maximum, and a minimum of 30 minutes, 30 to 40 minutes sessions. So this is the case notes. This is an official test, authentic test. Yeah. So you can get the case notes from here. Yeah. So Anne Ballard. This is the case notes. That's it. Anne Ballard, 2nd degree burns. Anne Ballard, 2nd degree burns. So we are going to. Now this is the case notes. You can go through this for 1 minute. So you are the charge nurse on duty, Children's Hospital, inpatient ward, because it is admission. You can see admission and discharge. So there are 6 days in between, or 1 week. 1 week. So admission date is there and discharge date is there. So that says that inpatient is this child is in a ward. Admission date is 16th March and discharge date is 20th of March. Okay. And this patient is an infant. It's an infant. And the age is 22 months. The name of the patient is Anne Ballard. And the name of the mother is Christine Ballard. All the important things we are taking, relevant information. So you have been caring for this patient, Anne Ballard. And the mother is, because this is an infant, mother also has to be taken into consideration. And the diagnosis is a 2nd-degree burns to the right trunk and the right arm. And the reason is accidental scalding with hot water. By accident. Okay. Accidental scalding with hot water. This is the cause and this is the result. And it was diagnosed 2nd-degree burns. The burns were diagnosed as 2nd-degree burns to the right trunk and the right arm. Now, fine, what else is needed? Go to the last. So you are writing a letter. You're writing a letter, okay, to the family's local maternity and child health nurse. The family's local maternity and child health nurse. Okay. And you have to outline relevant information and requesting follow-up on a discharge. So this is a discharge letter here. So this is a discharge plan. So this are important. Once the baby is discharged, these have to be taken care of. So now let us see here. So discharge letter. It's a discharge letter. So then, now go through this letter. This is the first half of the first page. So now let us see. Using the information given in the case notes as the charge nurse on duty. Charge nurse on duty. Okay. So writing the letter. Address the letter to Greenville Maternal and Child Health Center, Okay. And you are writing to whom? Maternal and child health nurse. You are writing to maternal and child health nurse. Greenville Maternal and Child Health Center. And that is on the main road. And that is in Greenville. So this is the address. This is the address. So now, how are we going to write this letter? So you can write this letter here, 4 lines. So maternal and child health nurse. So you are writing to her. You are writing a letter to the family's local maternal and child health nurse. So maternal and child health nurse, local, that means in Greenville. Okay. Then the address is Greenville Maternal and Child Health Center. So RE or ER, both are okay. It's on the main road, ROAD capital R and Centerville. So that's it. This is the address. So here you will get the information from. So maternal and child health nurse and Greenville Maternal and Child Health Center. This is the recipient of the letter. And this is the location where she is working. And that is main road and Greenville. So these 4 things will come. The next one, you're writing the date. Now the date, discharge date is 22 March 2010 and admission date is 16 March 2010. So 7 days from 16 to 22, 16, 17, 18, 19, 20, 21, 22, 7 days, both days inclusive. So 1 week, the child is in the hospital, 1 week. So inpatient ward, inpatient ward. So it's not an operation. Okay, it's inpatient ward. So right. Now let us see again. The date. We don't know what is today's date here. We don't know what is today's date here. So this type of confusion will always be there. If today's date is not there, then what should I write, sir? So being discharged today or tomorrow. So the same style will be there. And if the exam date is 22nd March, and the discharge date is 22nd March, the day on which you are writing the exam is 22nd March. So exam date, it depends on the exam date because you will write the exam date only. You will always write the exam date. Remember that. Only exam date. There is no question of other than that. So date will always be the exam date. So depending on your exam date, this date will be. So if you are writing exam on 21st March, then it will be discharged tomorrow. If the date you are writing is 20th March, then it will be discharged day after tomorrow. And if the exam date is 22nd March, you are sitting in the exam hall on the 22nd of March, then being discharged today. That is how it is going to be. So exam date only you will write. So suppose today is, let us consider that today's date is 20th March, because that is what the letter was considered. Nowhere it is given that today's date is 20th of March. But in the answer sample, they have given 20th of March. That means today's date is 20th of March. That is not given by mistake. By default, it is not given. So the date is 20th of March in the official sample. They should have given that one, but they did not give in the case notes, as we have seen. Assume that today's date is 20th of March. So assumption based on the sample answer, based on the sample answer. So, okay, based on the sample answer, we don't know what is the today's date here according to the case notes. Based on the sample response, okay, given by the official OET, sample response by the official OET. This is official OET paper. So you can see at www.occupationalenglishTester.org. Okay, this is an official sample from the official book. So you want to see, you can check it here. So this is there. Okay, you can see here. So this is official book. So you can see here, official OET preparation materials. From there we have taken nursing writing. So no need to worry at all regarding this. Okay, so exam date. Okay, today's date is based on the official sample response by the official OET. Okay, you have to assume, that is assumed date. Assumed today's date. Today's date. Sorry. Today's date. What is the today's date? Is 20 March. Based on the sample, I am not giving anything of my own. So 2010, sorry, 2010. That is what is assumed date according to here, 20 March 2010. That is the today's date. So there is no excuse for that one. We don't have any option. Okay, actually they are supposed to give. But even if they do, no problem, because test date will be test date. Okay, you'll write test date only here. So based on this information, it is 20th March 2020. The test date on which you are going to do the exam is 20 March 2010. So that's it. This is the date. So that is, you are going to write this date. And the discharge is being planned for a day after tomorrow. She will be discharged a day after tomorrow. That is the sentence you are going to write. Okay, that is the sentence you are going to write. You have to be a little careful. Yeah. So this is so 20th March 2010. And here the address is already here. Yeah, so this is the address and this is the date. We can understand how this has come. Next to the subject, salutation. So salutation, from where should get maternal and child health nurse. From here you have to take. So the salutation will be dear nurse. That's all, dear nurse, nothing else. Don't write dear maternal and child health nurse. Everything is not needed. Dear nurse is enough. So dear nurse. Dear nurse. Nothing else you will be writing here. Only dear nurse. Okay. Don't write anything else. Dear and nurse. If name is given, name should be written. Okay. Right. And then next one is, yeah, subject. Now what is the subject? Subject is here. Anne Ballard. Anne Ballard. 22 months. 22 months. Anne Ballard, 22 months. Okay. You can write in any way possible. So even if you don't write also age, no problem. Anne Ballard, okay, 22 months. Okay, you can write. Or else just write Anne Ballard and leave it. 22 months, 22 month old, you can write, or leave it. No problem. That's not very serious thing. Okay. It's not very essential. Right. Now let us see here. Subject, we are using this as a subject now. So regarding colon Anne Ballard, finished. Regarding Anne Ballard. So this is how you are going to write. Okay, let us place it here. Right. Anne Ballard. Right. So that is finished. Next one, subject. Subject, what we'll write? Sorry, this is the subject, regarding, and this is the salutation here, and this is the subject. Regarding Anne Ballard, or regarding Anne Ballard, 22 months, or aged 22 months, or just 22 months, or leave it like that one. Okay, just subject regarding whom you are writing, that's enough. Regarding Anne Ballard, there is not compulsion. Okay, there is no compulsion. Okay, you can see the sample response also here regarding Anne Ballard. That's enough. Okay, regarding Anne Ballard. Right. If you want to write, you can write the age. Otherwise, leave it. No problem. Okay. Right. Next one. Then we'll write the body. After the body, we'll have to write the closing remarks. You have to write the closing remarks. Now, closing remarks will go like this. Here it is, dear nurse. Name of the nurse is not given. So you can write yours faithfully or yours sincerely. Yours faithfully should be written here because name is not given. It's not a personal letter, but it is a professional letter. So you can see here, this is not a letter to a particular nurse. It is generic. That means any nurse who is there, the charge nurse. Okay. On duty, charge nurse on duty. So charge nurse on duty. You can see here, you are the charge nurse on duty. Yours faithfully, charge nurse. So here you are writing charge nurse and then inpatient ward. Inpatient ward. Then it is children's hospital. From where did you get all this information? So you can see here. Okay, you are the charge nurse on duty at the children's hospital. You are the charge nurse on duty at the children's hospital. So here you are writing like this. So yours faithfully, because we don't know who the person is. Name is not given. So write yours faithfully. Then the 3 lines, leave 2 lines in between and write charge nurse, inpatient ward, children's hospital. So with this, we finish everything else. With this, we are finishing everything else. Now, what you are supposed to do here, you see, you are going to write 4 paragraphs, plus 3 paragraphs, plus 1 introduction and 1 conclusion. Okay, you are going to write 5 paragraphs altogether. So introduction, what introduction you can write? Introduction you can write regarding this. You can write regarding admission. Okay, you can write regarding admission, or you can write regarding diagnosis, admission or diagnosis, or you can write about recuperation, recuperating from 2nd degree burns. Okay, admission due to 2nd degree burns, or you can say diagnosed with 2nd degree burns, or you can say recuperating from 2nd degree burns. Whichever you are comfortable, you can write here. 3 things you can write. Admitted with 2nd degree burns, or diagnosed with 2nd degree burns, or recuperating from 2nd degree burns. You can talk anything, no problem there. So the 3 things here are, so you can talk about admission, admitted, okay, admitted with, you can say, or you can say diagnosed with. So this is okay, Anne Ballard, comma, who was admitted with, or who was diagnosed with, or recuperating from. Recuperating from. So admitted with, or diagnosed with, or recuperating from. You can write anything. But what is the thing is here, 2nd degree burns. That is, okay, admitted with 2nd degree burns, or diagnosed with 2nd degree burns, or recuperating from 2nd degree burns. However you want to write, you can write following accidental scalding with hot water. Okay, accidental scalding, accidentally scalded, or accidentally scalding. Okay, accidental scalding or accidentally scalded with hot water. Okay, so you can write that one. And you can also write what is required there. What is required here? What is required? So follow up on discharge, follow up. Okay, follow up is required. So you have to outline relevant information and you have to request follow-up on discharge. Okay, follow-up. So regular monitoring and appropriate management. Okay, so here you can see daily syllabus and dressings, ongoing care and appropriate management. You can say follow-up, ongoing care, follow-up care, management. You can write here what he requires, what she requires is, okay, requires. So these are the things you can write here. Okay, ongoing care and appropriate management. So then following the discharge day after tomorrow. Okay, I'm giving you some points here. Following the discharge, or the discharge is being scheduled for day after tomorrow. Following the discharge on 22nd, or discharge day after tomorrow. Okay, so like this. So following the discharge day after tomorrow. These are the things. So admitted with, diagnosed with, recuperating from, or ongoing care and appropriate management following the discharge day after tomorrow. So these are the things which you can write. So that is how this goes. And what second degree burns to right trunk, the right trunk and the right arm, the right trunk and arm, right, both trunk and arm. So you can see that one. So all these things you can write. Okay, so this is the condition, right? The next one, the next paragraph, you can write about during hospitalization. Okay, this is hospitalization. This is first paragraph finished, introduction. Paragraph 1 is introduction. This is the introduction. Okay, so this is paragraph number 1 is introduction. Paragraph 1 is introduction, done. Okay. This is introduction. First paragraph introduction is done. Second paragraph is hospitalization. You can write about hospitalization. This is second paragraph you can write. Okay, what happened in the hospital? Okay, medication, medical history and medications. Nothing is remarkable here. Nil medications, nil significant history, no known allergies. So this is unremarkable or uncomplicated. You can use these words. Unremarkable. Okay, unremarkable. The condition, hospitalization. This is paragraph number 2 is hospitalization. During her stay in the hospital or hospitalization. During the period in the hospital. So during hospitalization, comma. So this is during hospitalization, right? So this you can take a second paragraph. During hospitalization, what is the condition? Now let us see. What is the condition here? Here you can see this is paragraph number 2. These two things, medical history and medications and management and progress during hospital stay. These are the things which are important. So what you can write here in the second paragraph are, now the first one is uncomplicated condition. The condition was uncomplicated. Okay, condition uncomplicated. So first point is condition. Condition. So condition was, you can say uncomplicated, uncomplicated or unremarkable, uncomplicated or unremarkable or normal. It's not abnormal, it's not remarkable. So normal, everything was normal. Okay, everything was normal, no complication, no remarks, and no abnormality. Everything is perfect. Okay, condition has been excellent or uncomplicated or unremarkable or normal. Okay, normalcy. Okay, whatever you want to write, you can write. Okay, then medical management and progress during hospital stay. This is, you can write one point here. This is point number 1. Everything is perfect. That you have to write. Then second point is, this is the second point. What is the management? What management was done and what is the progress there? So this progress is related to first one is dressings. You can see there dressing. Okay, regular daily dressings to the infection site or burnt site. Okay, dressing, regular daily silvazine dressings. So it is regular. 2 into daily. Daily means regular, periodic. Regular daily silvazine dressings. Dressing changes. Regular daily silvazine dressing changes twice daily. Twice daily. Regular, twice daily. You can say twice daily. Regular silvazine dressing changes twice daily. Okay, to the infection site, at the infection site, at the burnt site. Okay, at the burnt site or burnt site, at the to the affected area, whatever it is, change. Okay, site. Okay, whichever sites, not one site, sites. Okay, affected sites, affected locations. Don't write the same site. Okay, affected area means sites or locations. Affected parts or locations. Affected parts or locations. You can take that one. Affected parts or the locations. You can write this one. So regular daily, silvazine, twice daily. Silvazine dressing changes the affected locations. Okay, that is number 2 you can write. Then after that one, you have to write about this one. IV fluids. IV fluids, 24-hour post-admission and then oral fluids. So this is fluid, okay, intake. This is medication, IV fluids, oral fluids, okay. Then you can see antibiotic cover and analgesia. This is medication. You can write about analgesia. This is analgesia, okay, analgesia, right? And prophylactic antibiotic cover. These are the things you have to mention, okay. So intravenous fluids, okay, and then oral fluids. So how he was she was treated. So you have to present there. So analgesia, you can take analgesia, okay, analgesia. So this is a course of analgesia which was given, okay. Medications, regular course, okay. It may be a course, okay, what the course of analgesia. And then next one is prophylactic antibiotic cover, okay, prophylactic antibiotic cover. So prophylactic antibiotic cover, okay, this also you can write. So this is ongoing now because in the hospital 2 days afterwards she will be discharged. This is in progress, so all these things are needed. All these things are needed, right? So currently she's on oral fluids because IV fluids is finished. IV fluids role is finished now, 24 hours only. After that one, post admission. Admission was on which date? 16th. So 17th. So this is finished now. IV fluids, you need not discuss about this one. Now currently she is on oral fluids. You can understand here because today's date is 20th March. So 17th IV fluids closed, and now currently she is on oral fluids. Okay. So think if it is relevant, you write this one. Otherwise, no need to write IV fluids because it's finished now. She is no more on IV fluids. Okay. Now she is on oral fluids, oral consumption of fluids now. Okay. Then you can manage that one. Then after that, this is the second paragraph. This is the second paragraph. Now, next one, what you have to do? Okay, discharge is already discussed here. Okay, discharge is already discussed here in the beginning only. Following the discharge, day after tomorrow. So she requires what? Silvazine dressings, also continuation. And what else? Follow-up management. That has gone already. Okay. So here, ongoing care and appropriate management after the discharge. Okay. This is gone. Discharge on 22nd, day after tomorrow. So because today's date is 20th March, so day after tomorrow means automatically 22nd March is understood. So the next one, next paragraph. So no other action is required there. So after discharge, what is required? You see there. After discharge, see, these are things. No discharge medications. No other medication is there. No other medication. So daily silvazine dressings are required. So this you will be writing discharge plan. Discharge plan you'll be writing. Okay, discharge plan. We first will concentrate on the baby only. Okay, so this is a little complicated letter. So first focus on the baby. Then afterwards, other things you have to discuss. So daily silvazine dressings should be continued. Regular daily silvazine dressing changes have to be provided. So this is what you will write here. Dressing. So you can write about dressing. Number 1, following the discharge day after tomorrow, what are required? So dressing changes. Dressing changes. Okay. To be continued. To be continued. Continuation. Continuation. To be continued. Number 2. Number 2. No other discharge medications. No other medications are required. You can see here. No discharge medications. All are done. Okay. All are done. So no discharge medication means no more treatment. Finished. No further treatment. No additional treatment or management or medication. No other treatment or medication or management. Okay. No other medication or treatment or therapy is required. Nothing is required now. This is the second point. And you have to say this is mother's mental state will go into the next one. Only child who you have to take here. Don't confuse everything and don't mess up everything here. Okay. Don't mess up everything. Only these 2 things you have to take. Okay. Only these 2 things you have to take here. So not this. So here. This is the child. So write only about the child. So these are the 2 things. Number 1. And number 2, no discharge medications. So these are the 2 things that you have to bother here. With the post-discharge, these are to be done. I told you this is a little complicated case. So you have to treat the patient differently and the patient's mother differently because it is a dependent mother and child. Child is inseparable from mother because she's just 22 years old. Okay, everything is important here. Somebody should be monitoring because the patient cannot take care of herself. Okay, take care of herself. So mother is to be taken care of and somebody else also should be involved here. So that is very important. Now next we will talk about mother. Now next paragraph is about mother. Okay, you have to talk about, so this is during hospitalization. This is post-discharge. Post-discharge. Post, paragraph number 3 is post-discharge stage. Post-discharge or a discharge plan. Okay, we'll write about this one. Yeah, post-discharge. After discharge, now we'll talk about the mother. Okay, now write about the 4th paragraph about mother. Okay, 3 paragraphs are first introduction, then during hospitalization, then post-discharge. Okay, now mother is really, bring mother into the picture now. In the 4th paragraph, you have to write about mother. So, mother, 4th paragraph, write about mother. Okay, mother, Anne's mother, Christine Ballard, you have to write about mother. Mother's case. Write about the mother's case. What is her mother's problem? Now write about the mother's problem because that will definitely give an impact on the child. So what is the mother's problem? So you have to think about this. Mother's problem is here. Mother's mental state. Monitor mother's mental state. Okay, this is number 1. Okay, this is number 1. You have to monitor mother's mental state because she is not very fine. She is not very fine. Why she is not fine? Go again here. Mother is just 28 years and separated from husband 4 months ago. 4 months ago, after the conception of the child. Okay, got separated, right? Separated from husband 4 months ago. Mother separated. Okay, mother separated from husband 4 months ago. She is just below 30. You can see here. Okay, 4 months ago. Recently, you can say 4 months ago means recently. Has been separated. Recently has been separated. Okay, 4 months ago. Okay, recently, remove ago and say mother was separated, you can say, or recently she has been separated, or mother was separated 4 months ago, or mother has been separated recently. If you want to write 4 months ago, the word ago means automatically it will go to past tense, simple past tense. If you say recently, means mother has been separated from husband recently. That's enough. Don't say 4 months ago. If you say 4 months ago means past tense. Recently means present simple. Present perfect. You can use. Be careful with the words ago. If you are using ago, you must use simple past tense. Okay. The sentence, how you are going to write the sentence. Yeah, we need another 10 minutes. Okay. I told you 40 minutes maximum, 30 minutes minimum, 40 minutes maximum. So, right. We shall take 10 minutes more. We are going to take 10 minutes more. Right. So here, let us see how to differentiate past tense and present tense. That is what I am going to show you here. So, okay. Let us see the sentence here. Miss, okay, Miss and Miss, what's the name? Christine Ballard. Okay, okay, Christine Ballard. Okay, separated. So Miss, we were confused now. We don't know whether it's Mrs. or Mother Christine Ballard. Separated. That's all. I don't know whether she's married also or not, but separated. Okay, we don't know what condition it is. So just write Miss Christine Ballard. Okay, complicated condition. So write Miss Christine Ballard was Miss Christine Ballard was separated from her husband 4 months ago. 4 months ago. Why you are writing here was separated? Because 4 months ago you are using the word ago. You are using the word ago. Okay, that's why you are using right. Yeah, Miss Christine Ballard was separated from her husband 4 months ago. Right. Or you can say Miss Christine Ballard. So how you are writing the sentence depends on these words. Okay, has been separated from her husband recently. You can write that like this also, you can write, no problem. Okay, right? So this, you can say recently means you can say has been separated. Recently, just recently means present perfect, finished. Otherwise, if you say the word ago, it depends. The tense depends on the words which you are using, the time words. These are called the time framing words. Okay, let us see ago. When you say ago, you must use simple past tense, was separated. Okay, was separated. If you use the word recently, you cannot use was separated. You have to use has been separated. So that is the point here. How you have to understand was separated. When you say was separated, okay, you use was separated when it is, okay, ago. Okay. When you use the word recently, okay, yeah, these are the conditions now. Was separated ago, has been separated recently. Right. So this is the way how you can write. You want to write past tense or you want to write present tense? Think about that one. So the way how you 4 months ago means past tense, finished. It's month. This month is present tense. 4 months ago is past tense. Last month also is past tense. So you have to write simple past tense. Recently means this period, this year. Recently, any time of this year. Forward or backward is recently. Okay. Now you see recently finished. So it has been separated, present perfect. That's the way how you can write. So you can write about this one. And because of this, okay, what is her condition? What is her condition? So mother separated from husband 4 months ago. And because of this one, she is socially isolated. She is socially isolated, means independent. There's nobody to take care of him, take care of her. So mother, nobody is there to take care of her. She is socially isolated because Christine's parents are interstate. Okay, they have, she has few friends only. She has only few friends, not too many friends to support her. So parents are interstate and she has only few friends. So that's why she is isolated. Nobody to bother about her. Nobody is to take care of her. Okay. Then apart from this, okay, she appears to be depressed. Okay, possibility of depression. Depression is noticed. Possible, okay, suffering from depression. Okay, has been observed. Depression has been noticed. Okay, question mark means doubtful, means not sure. That means they are estimating her condition. Okay, possibly she is depressed. She is in a depressed condition because of social isolation. She is separated from her husband. Parents are not there. Only few friends. Nobody is bothered about her. That's why she is socially isolated. Because of this social isolation and nobody to take care of her, she is in depression. Maybe possibility that she is going into depression. Okay, she is going into depression. So next, one more thing is children spend alternate weekends with father. This is another problem. So alternate weekends. So first weekend with mother and the next weekend with father. Alternate weekends with father. So during that period, she will be totally alone. The daughter and son both will be with father. Okay, because they are separated already. So 1 week with mother, 1 week with father. So you can understand at this particular situation, nobody, even the children are not there with her. So it is total depression, you can see. And she's away from her children also. Okay, small children, 4-year-old brother and 22-year-old daughter. Okay, both of them will stay away. So because of this depression is there. Then apart from that, she has financial difficulties after separation. After separation, she has financial difficulties because earlier husband used to bother about that. But now husband is separated and she's not getting anything from her, maybe from him, maybe. So financial difficulties, or maybe she's getting some pension or from some amounts or something from him, or whatever it is. We don't know about that one, but financial difficulties are there. Okay, financial constraints, financial difficulties or constraints. Okay, limitations, financial limitations are there, problems are there, difficulties, concerns are there. You can use all these words there. Okay, constraints. Don't use the same words. Don't use the same words. Okay, let me give you the words here. Financial constraints. The different words are constraints, concerns. Okay, limitations. Financial limitations, constraints, concerns, okay, problems, okay, financially limited, restricted, restrictions, you can say, limitations, restrictions, restricted income. Okay, you can use it. You cannot use the one word directly. You have to modify the word along with the sentence. Okay, restricted or restrictions or okay, whatever. Then next one, that is it. So no need of this bedroom house and new housing development, family reliant on public transport. This is all not that much necessary here. Then, so that is all related to 3-bedroom housing, new housing development. Okay, family reliant on public transport. That is all financial difficulty. Okay, the next one. You can also write about, okay, this is what you can talk here. Okay, in this paragraph. And because of these financial constraints, what can be done? What can be done is here. Okay, this we did not. So okay, 2 into daily silversand dressings, then IV, okay, medications, prophylactic antibiotic cover, and analgesia. So these are discussed, and then no medications, no, all these are nil, unremarkable. Okay, unremarkable condition. The condition is unremarkable. Medical condition is unremarkable. There is no problem with anything. Okay, no any history, no any medications, no any allergies, nothing else. Okay, right. Then now, so after this one, what she needs, okay, what she needs, you can see here. So financial advisor is needed. Financial advisor, appointment local with financial advisor to bring out some financial problems, solutions. Okay, to get some solutions. So financial counselor, how to manage the financial condition or how to involve in some financial activities. Okay, income generating activities. Okay, something like that. Financial counselors, some counselor will come and counsel her regarding financial, how to live in the limited finances or how to increase finances. So involve, okay, an appointment with a local financial counselor for providing guidance to involve in finance generating programs, okay, would be beneficial. An appointment has to be scheduled, okay, arrangement should be done so that she can learn how educate herself in managing with the limited resources or income generating sources, okay. So so managing, there are two things here. The financial counselor will give two things. What are the two things maybe? So first one is managing with the limited financial resources. Okay. Number one is managing life with the limited financial resources, managing the condition, managing the situations, managing life, okay, managing lifestyle, or managing life with the limited financial resources. This is one. What all limitations are there? She has to manage like that only. Or number two, participation in income generating activities, participation in certain income generating activities, because that is not enough. Now the child is also there, so income generating activities, okay. So these are the two things he can guide. So for local financial counselor can guide her regarding two things: already existing limited financial resources, how to manage with them. Number two is, if that is not sufficient, then how to involve a mother in participating in certain income generating activities, like some activities which can generate some income, like stitching, or at home stitching dresses for others at home, or doing some handwork or something like that. Some other activities, okay, where income can be generated, okay, not disturbing her family life. So these are the two things that you can write regarding this, to manage this financial problem, to come out of this, to survive this survival, you can say, for surviving these tough times. Okay, next one, introduce to local supports. So this also should be introduced. Why to local supports? To remove from this boredom, okay, depression, to come out of this depression. Financial, this is regarding financial condition, okay, financial difficulties, that is addressed, local financial counselor. Then what is this? Depression. So she is depressed because she is lonely, isolation, so she is depressed. So if she wants to come out of this depression, she should come out of this social isolation. So in order to come out of this social isolation, what she must be done here, what she has to do is, she has to participate in group activities, like mothers group activities, okay, mothers group activities, local child care center. She has to go to local child care center, and she has to leave there the child, and she has to participate in the child care center activities. She should make there some games or some activities for child care. Local child care center may be there, so she has to take the child there, and she has to get her training there, and she has to give to the responsible nurse or supervisor in the child care center, okay, some responsible, okay, local support, okay, for the children. So she has to take care. So if she takes there the child, she'll be involved in some activities there, in group, mothers group activities for herself, child care center for the daughter. So both the mother should be educated, they should be sent there, okay. So mothers group activities and child care, both the places she has to visit, okay. And the local support should be provided for enhancing lifestyle of mother and also the child, okay, for that reason. So now if the mother involves in participation in mothers group activities and the local child care activities, so she will come out of this boredom. What is this boredom? Isolation, social isolation, means not with anybody else, and depression. So she should come out of this depression. If she is already participating in these activities, her mind is fixed, and she will not think about that loneliness, okay. Isolation means loneliness, okay. Boredom, you can use the word isolation, boredom. To overcome boredom, survive with the financial situation, overcome, survive the limitations, survive financial difficulties. She has to participate in income generating activities. Then next one, to come out of the social isolation and depression and okay, being upset, she has to participate in mother's group activities. Okay, so society friendly activities, she has to participate there. Okay, because she has no friends, she has to participate some activities, and she'll spend her time. Otherwise, if she's alone, she'll be only thinking and she'll get depressed. That's what it is. So empty man's brain is devil's workshop. So like that one, mentally she'll be more depressed. So you have to bring her out of the condition. So for that one, okay. Right. So these are the things. This is the last paragraph that you have to write. And then so these two things you can write about. First one, 2 paragraphs you can write. This is what is this paragraph about? 4th paragraph, mother's case. Okay, mother's case. 2 paragraphs you can write. Mother's case regarding financial situation. Then 5th paragraph you can write mother's case. So this can be 4A and 4B. Okay, 2 small paragraphs or 1 big paragraph. So 2 things can come here. First one is regarding financial problems. First one is for financial, you can say financial. And next one is social. Okay, financial, social, personal. So this is personal, you can say, that is financial, and this is personal or social. So 2 paragraphs you can separate, or you can write 2 paragraphs together. So you can see financial, all the financial things in 1 paragraph. Okay, so she separated. So financial difficulty, she's separated, and she's individual, so she has personal difficulty. That's boredom, depression, no other activity. Okay, loneliness, all these things will come. So this is only money aspect, financial difficulties after separation. So she has to manage. So all these things you have to write. And to manage that one, local support groups. Okay, that is the way how you can write. And then personal. So she has nobody to take care of anything. So she will be depressed. So she has to come out. Loneliness. So she has to participate in social activities like mother's group activities and local child care center. And she has to involve herself actively so that she will be fully engaged, and then she can come out of depression. So because some other activity is there, she'll come out of that loneliness. So this is how you can write. Otherwise, you can write all the problems in paragraph number 4 and all the solutions in paragraph number 5. That is also you can financial 4 and personal 5, or problems 4, solutions 5. You can write in both the ways, no problem. So this is 4 and 5, 2 paragraphs you can write. So first problems and solutions. Okay, all the problems, financial problems and personal problems, that you can write. So how to do this? Yeah. Okay, what I'll do is here, like this I'll do. So first financial, then personal. So this is the way how you can go. Either you can write financial first and personal next, or you can write all the problems first, financial problems and social problems first, and then solutions next. So this is the way how you can write. I think this is better. Both are okay. So there is no problem in this. So 4th paragraph, you can write financial problems, and 5th paragraph, you can write personal problems. So financial problems and solutions in 4th paragraph, personal problems and solutions in the 5th paragraph, or in the 4th paragraph about problems. Okay, problems, financial and personal, both problems in 4th paragraph, and both the solutions in 5th paragraphs. So this is the way how you can write, or you can join both the paragraphs. However you want to write, you write, but let it not be messed up everything. Okay. So only 5 students are there. I really appreciate you. That's the point. Many people are working. I don't think they can attend. So it's okay, no problem. So I want you to give a valuable feedback for what you have learned. Okay. It was exactly 1 hour session. Okay. So we started at 1 o'clock and we 2 o'clock, and we exactly closed at 3:05. Okay. Right. A little lag. Fine. So please feedback. So is this explanation beneficial or not? I want your valuable feedback because I'm implementing some changes and modifications. In the meantime, I'll be calling one by one, and you will be sharing your opinion. Others I want to. So according to the point you have written, if you don't write, I will call you and ask. Yeah, first Meera, Manoj. Thank you, sir. Well explained. Yeah, I'm going to unmute you people, all of you. So Meera Manoj, can you share your experience? How do you feel regarding this experience?
Hello, sir. Good afternoon.
Good afternoon.
It was very wonderful section, sir.
Okay, can you explain a little bit further? How was this beneficial for you?
Sentence structure, organization.
So number one is organization. Okay. So according to you, yeah, sentence structures. Okay, sentence structures. Okay. And number two is organization of paragraphs or subject matter. Organization. Okay. So two things. Yeah. Can you share some more points in a few sentences, 2 or 3 sentences, please?
That explained very well in a nutshell.
So earlier I was taking long lectures and giving too much explanation and too much participation. This is a one-sided lecture. So that is better or this is better? Which do you think? This is saving time. That is knowledge gaining. This is saving time. Here also you are learning, but here participation is very less. Only passive lecture is there. So which do you think is better? That is better or this is better, or both have their own advantage? What can you give me in your own words, please?
Both have its own advantage. Sometimes it's better to ask and explain relevant and irrelevant points. And how to write the sentences and bring new vocabularies.
Okay, so you gave the third point, that is relevant information. Do you think you got all the relevant information here or no?
Yes, sir, I got.
Okay, can you submit this letter today?
Yes, sir, sure.
Okay, fine. Thank you very much for your feedback. That was really nice. Okay, next in order is Folidare. Hello, Folidare. Folidare.
Good afternoon, sir.
Good afternoon, Folidare. Where are you from?
I'm from Nigeria, Ota, Nigeria.
You're from Nigeria. Okay. Yeah, Folidare, can you share your experience?
Yeah, it's been a wonderful session, and I have a better grasp of information that should be included in a discharge letter and those that should be left out, and how to structure the sentences, and then more importantly, coherence in the flow of thought. Those are the things I'm able to get this afternoon.
Right. Okay. What are the points? Any additional points other than these 3 points Meera has given? So first one is sentence structure. Second one is organization. Third one is relevant information. Other than these, do you have any points to mention here?
No, not at all. Rather, I've been able to add to my idea of how the letter should be organized. How it should be organized in terms of sentences and then the general structure of a discharge letter.
Okay, fine. Thank you very much for your valuable feedback. Neetu.
Yeah.
Hello, Neetu.
Yes.
Hello. Hello, sir.
Yeah, Neetu, can you share your experience? What did you learn? How was the session? Were you there from the beginning or you came in the middle?
No, sir, I joined from the first.
Okay, yeah. So tell me.
Yeah, yes, sir. That's a very good presentation, sir. Actually, but I want to tell you one thing that I have some confusion regarding writing passive voice, sir. So if you include that more, means that also beneficial, sir.
Okay. So passive voice. Okay.
Means the
Passive
sentence
voice.
structure, sir. I don't know. Oh, I don't know more. Actually, I know how to write active, but when it how to write passive, sir, that little bit confused. So
Yeah. Okay, fine. Today we'll take one session on passive voice. Okay. Today,
okay.
after all of you, how many of you write these letters? Okay, then we'll take some sentences and we'll change it to passive voice. The same letter, better, na? Okay. You remind me in the evening. I will arrange one 20 to 30 minute session for passive voice. Okay. Passive voice.
Okay.
Remind me. Anybody who is attending this session, please remind me because sometimes I forget. So please remind me. Passive voice session we can do in the evening. Okay, sometime. And next, very good. Reena Saini.
Yes, sir.
Yeah, Reena Saini. Were you there from the beginning or you came in the middle?
Sir, in the middle.
Okay, so after you joined, what did you learn?
So every time we learn different things, and I want these kind of sessions. No doubt other lectures are also best, but we learn many things from the others. But sometimes that lectures are taking time, like you are doing some arrangements in the sessions. But I like this session most.
Okay, fine. Okay, very good. You can go and watch the video from the YouTube. I have already posted in the Telegram channel. You can take the link and whatever you missed, you have to go and recover from there. Okay, retrieve from the YouTube. Okay, and next step.
Okay, sir.
Sai Sindura. Sai Sindura.
Hello, sir.
Yeah, okay. Share your experience, Sai Sindura.
So first when I got to know this letter, when I saw it was really tough for organizing such like when to include about the baby and where to add structure about the mother's care also. So and sentence like using passive voice in the sentence and structure. So I mean now I have ideas if this kind of letters come.
Yeah.
I am able to attempt.
Yeah, I'm going to post these two relevant and irrelevant information, and I will send this. I'll save this PDF, and I'll send it to you. File, save as, selection criteria, same file. Okay, and I'm saying this is relevant information. Relevant information. So that is it. So this also I will send it to you. Okay. So I'm posting it here in the Telegram channel. So relevant information is here. So here it is, relevant information. So I'm placing it here. So that is the case notes and this is relevant information. So you can take from here and I can even give you the pictures so that it is colorful. Yeah. Close this, edit. You can take the notes from here, take a snapshot, select all. Okay, copy selected graphic. Okay, here it is there. The first page. Okay, page. Page 1. And that is page 1. You got the information here, page 1. And then next one is, okay, page 2. Page 2 is here. Select all. Okay. And copy selected graphic. And this is page 2. Page 2. So you can take it and you can write and submit the letter to me. Okay. And I will evaluate this paper. Thank you very, very much for attending this session and making it a success.